Ever wondered what causes that burning sensation in your stomach? It might be more than just a bad meal. It could be gastritis. Gastritis is an inflammation, irritation, or erosion of the stomach lining, and it's a common condition that can lead to discomfort, and in some cases, serious complications. This video will take you on an engaging journey, exploring the types, causes, symptoms, treatments, and precautions of gastritis. So buckle up and get ready for a deep dive. Now let's delve into the different types of gastritis. You might not know this, but there are several types of gastritis. Let's dive in and explore them, shall we? First off, we have acute gastritis. This type is characterized by sudden inflammation or swelling in the lining of the stomach, which can cause severe pain and discomfort. Then there's chronic gastritis. This type slowly erodes the stomach lining over a long period of time, often without any immediate symptoms. It's like a silent enemy, patiently waiting. Next up is erosive gastritis, which can lead to significant erosion or wearing away of the stomach lining. It's a real heavy hitter and can result in ulcers or bleeding. Finally, we have non-erosive gastritis. This type doesn't cause erosion or ulcers, but still results in inflammation. It's less aggressive, but not to be underestimated. Each of these types has its own unique characteristics, but all can lead to discomfort and potential harm if left unchecked. Now that we know the types, let's discuss what causes gastritis. So what actually causes this uncomfortable condition? Gastritis is often the result of an imbalance in the stomach, and several factors can tip the scales. The most common cause is an infection with a bacteria called Helicobacter pylori. This tricky microbe can live in the stomach lining without causing problems, but sometimes it leads to inflammation and gastritis. Another common cause is long-term use of NSAIDs or non-steroidal anti-inflammatory drugs like aspirin or ibuprofen. These medications can irritate the stomach lining and lead to gastritis. Excessive alcohol consumption is another contributing factor, as it can also irritate and erode the stomach lining. Additionally, extreme stress, whether from major surgery, injury, burns, or severe infections, can cause a particular type of gastritis, known as stress gastritis. Other causes include autoimmune disorders, where the body mistakenly attacks its own stomach lining, and certain diseases such as Crohn's disease and sarcoidosis. Understanding the causes leads us to the next part, the symptoms of gastritis. How do you know if you might have gastritis? Well, the symptoms can range from mild to severe, and they vary from person to person. The most common symptom is a gnawing or burning ache in your upper abdomen. This pain can either be occasional or constant. Another symptom could be a feeling of fullness in your upper abdomen after eating. This might be accompanied by indigestion, a condition that's characterized by a burning sensation or discomfort after eating. You might also experience nausea or recurrent upset stomach, which can sometimes lead to vomiting. Vomiting blood or coffee ground-like material is a serious symptom and needs immediate attention. Gastritis can also cause changes in your stool. You might notice that it's black and tarry, indicating the presence of blood. Lastly, bloating, a feeling of fullness in your abdomen, is another symptom that you shouldn't ignore. If you experience these symptoms, it's important to seek medical help. Now let's talk about how gastritis is treated. So, what can you do if you have gastritis? Well, the good news is, gastritis can be treated effectively, and often, simple lifestyle changes can make a world of difference. Standard treatments typically involve medications to decrease stomach acid, which can give your stomach lining a chance to heal. These may include antacids, proton pump inhibitors, or H2 blockers. However, it's essential to consult a healthcare provider before starting any medication regimen. In tandem with medications, incorporating lifestyle changes can significantly aid in managing gastritis. Eating smaller, more frequent meals throughout the day can prevent the buildup of excess stomach acid. It's also advisable to avoid eating within a few hours of bedtime to reduce nighttime symptoms. Now, let's talk about precautions. Gastritis can often be prevented by making a few tweaks to your routine. You can start by limiting or avoiding irritants such as alcohol, caffeine, and non-steroidal anti-inflammatory drugs, or NSAIDs. These substances can inflame the stomach lining, leading to gastritis. If you're a smoker, quitting can greatly reduce your risk. Stress management techniques like meditation or yoga can also play a part in preventing gastritis. Chronic stress can trigger stomach acid production, leading to inflammation. So by making mindful choices about what you consume, how you eat, and how you manage stress, you can both treat and prevent gastritis. Remember, gastritis is something that can be managed and prevented with the right knowledge and precautions. So, we've learned a lot about gastritis today. We now understand that it's a condition where the stomach lining becomes inflamed, with various types like acute and chronic gastritis. We've delved into the numerous causes, from bacterial infections to certain medications, and the symptoms that accompany it. We've also explored the different treatments available and the precautions to take to prevent it. Remember, knowledge is power when it comes to your health. Stay informed and stay healthy.